Somali Family Service is guided by the framework that in order to create a healthier community, you have to have an empowered community.
At Somali Family Service, the way the unique needs of this community are met is through the educational workshops that are culturally relevant and culturally tailored to provide important information about the health of the community, providing important resources and tools so that the community members are able to advocate for their own health and be able to empower themselves, as well as destigmatizing important issues like mental health through providing workshops and presentations that address the misconceptions and myths surrounding mental health. Another important component is building trust and increasing cultural competency between providers as well as patients. And all of these programs are incorporating the cultural beliefs and attitudes of the community so that they can serve their needs better.
One of my favorite programs at Somali Family Service is Senior Men's Luncheons, which happens on a monthly basis, and what we do is provide a platform for them to come together, eat, and have a dialogue and discussions over a variety of health topics such as diet, nutrition, exercise, and more.
One of the example cases is the client who got a stroke and ended up going to the emergency room. And I happened to be the person who was helping it because the family has difficult understanding the depth of the issue, and I was translating and interpreting for the family. The client was in coma for a while, and the doctors told the family that he will not survive. And matter of fact, that if they can donate, his organs to save another lives. So not only that the patient is survive and recover from the stroke, he watched his kids grow up and get married.
I am an attendee of SFS's Lion Youth Program, and one of my favorite health workshops was Autism Forum, because I felt like many families that were challenged with adversity of having a child diagnosed with autism learned a lot, and now in their future they will be able to get the correct help they need.
My favorite health discussion was autism because I felt like I could relate to it, and I have family members who have autism, and it's a disorder that's very serious.
My favorite health workshop was the app one, where you downloaded apps and talked about how to keep healthy and eat good food.
SFS is a bridge between new Americans and the larger San Diego community. Our goals for 2016 are: 1. To increase health screening by 50%. 2. Provide more cultural sensitive training to the healthcare providers. 3. Continue mobilizing trained health ambassadors to provide health education, translation, and interpretation services. 4. Advocate for system change by facilitating a conversation between policymakers, health service providers, and the empowered community. On behalf of Somali Family Service Board, staff, volunteers, and the community we serve, I would like to thank Alliance Healthcare Foundation for their partnership and their continued support.